Hi again and welcome back. My name is Bernadetta Bellarida. I work at the World Health Organization where I lead work on rabies and other neglected zoonotic diseases. I am a veterinarian and scientist by training. In the previous module, you learned about the history, burden and biology of rabies. And now we will have a closer look at the strategy to eliminate rabies. The second module is titled the 0 by 30 Rabies Elimination Strategy. In this module, you will learn about why we must eliminate rabies. This module provides examples that show that rabies elimination is possible and why it is crucial to target dogs and take a One Health approach. We will also cover the 0 by 30 plan, how the United Against Rabies Forum supports action, and what other complementary initiatives support rabies elimination. Eliminating rabies is a global public good. If we do not act now, over 1 million people will die of rabies before 2030. The demand for post-exposure prophylaxis will also grow because more people will be exposed and poor and rural populations will continue to be disproportionately affected by systematic inequities. This means that the cycle of neglect of rabies and its impact on people and animals will continue, where lack of data on disease burden and associated losses drive the lack of political will, resources, and in turn, disease programs. Eliminating rabies also aligns with global goals such as the WHO goal to control 20 neglected tropical diseases, including rabies, by 2030, and the United Nations Sustainable Development Goals about the achievement of good health and well-being, the elimination of poverty, the reduction of inequalities, and the creation of partnerships to reduce disease burden. Eliminating rabies also strengthens health systems. Achieving elimination would mean that the need for post-exposure prophylaxis decreases, that expensive rabies biologicals are used in a more targeted way, that healthcare providers are better equipped to administer care to patients for rabies and other ailments, and that the appropriate logistics are in place. This contributes to universal health coverage, that is, where everybody has access to the health services they need without financial hardship, which in turn strengthens primary healthcare. Eliminating rabies is possible through increased access to post-exposure prophylaxis for people and mass vaccination of dogs. In 2019, Mexico successfully eliminated dog-transmitted rabies as a public health problem, which means no more human deaths from dog-transmitted rabies through sustained mass dog vaccination. You can see here on the left-hand side how human and dog rabies cases reduced to 0 following sustained high rates of dog vaccination. You can find more information about how to obtain WHO validation for the elimination of human rabies in Module 6 on diagnosis and surveillance. On the right-hand side of this slide, you can see that in Sri Lanka, human rabies cases significantly reduced following an increase in both mass dog vaccination and the provision of post-exposure prophylaxis. Globally, around 50% of animal rabies cases are in dogs, and around 40% are in wildlife, such as bats. Dogs, and in the Americas, bats, are responsible for transmitting rabies to livestock, such as cattle. However, wildlife transmission to people is very limited, and dogs are responsible for approximately 99% of human rabies cases. Because rabies is present in more than one animal species, it is virtually impossible to eradicate. Eradication would mean permanently reducing to 0 the worldwide incidence of any infection caused by rabies. However, dog rabies and dog-mediated human rabies can be eliminated so that no more endemic cases occur, which would prevent almost all human rabies deaths. Remember, 99% of human rabies cases are transmitted through dogs. Eliminating rabies requires a One Health approach. A One Health model refers to the collaboration between different disciplines and sectors to recognize the connection between humans, animals, and the environment, and the impact this has on health outcomes. Because dogs are responsible for transmitting most rabies cases to people, the number of rabies cases in dogs is clearly correlated to the number of rabies cases in people. Therefore, to successfully eliminate rabies, we need to vaccinate dogs to stop rabies transmission between dogs and from dogs to people. Check out Module 7 on rabies as an example of One Health economics for more information on why a One Health approach is the cheapest and most effective way to eliminate rabies. 0 by 30 is a global strategic plan to reach zero human deaths from dog-mediated rabies by 2030 worldwide. The plan, which was developed by WHO, the World Animal Health Organization, the Food and Agricultural Organization of the United Nations, and the Global Alliance for Rabies Control, in close consultation with countries and other actors, points to a common goal of 0 by 30 and drives to coordinated action against rabies. We need to change the status quo, put rabies endemic countries at the center, and create a unified coalition for success through 3 main objectives. The first, to effectively use vaccines, tools, and technologies to reduce the risk of human rabies. The second, to generate and measure impact, to provide reliable data and guidance. And the third, to sustain political and financial commitment through engaging stakeholders. 0 by 30 takes a phased approach to elimination by building a strong foundation, startup, engaging most countries in rabies elimination, scale up, followed by last mile efforts to engage remaining countries, mop up. The United Against Rabies Forum, led by WHO, the World Organization for Animal Health, and the Food and Agricultural Organization, provides an inclusive, country-centric and cross-sectoral One Health platform for rabies stakeholders to work together to achieve the 0 by 30 goal. There are 3 main pillars for successfully eliminating rabies. Firstly, by expanding access to rabies post-exposure prophylaxis, covered in more detail in Module 3 on preventing rabies in people. Secondly, by building awareness of rabies, covered in more detail in Module 5 on awareness and community empowerment. And thirdly, by implementing mass dog vaccination to stop the disease at its source, covered in more detail in Module 4 on preventing rabies in dogs. Rabies elimination and the United Against Rabies Forum itself involves many global, regional, national and local stakeholders, from international organizations to regional partners, rabies networks and One Health networks, to national stakeholders in human health, animal health, environmental health and education, to local governments, media and communities. The 0 by 30 plan is complemented by a range of global initiatives, including Gavi's support for increased availability of human vaccines, the Animal Vaccine Bank of the World Organization for Animal Health, for increased availability of dog vaccines, and the revolving fund of the Pan-American Health Organization in South America for both human and animal biologicals. Gavi, the Vaccine Alliance, has included human rabies vaccines in their investment strategy of 2021 to 2025. Although due to COVID-19 pandemic, there will be delays in the rollout of rabies vaccine, this support from Gavi will help increase access to safe and effective and WHO pre-qualified vaccines. It will also support the uptake of the cost and dose-saving intradermal vaccination regimen. Gavi's support will also help countries improve data collection, vaccine forecasting and procurement, and accountability for their use. The Vaccine Bank of the OIE is a virtual bank that provides countries with access to high-quality dog rabies vaccines. Countries can apply for vaccines through their chief veterinary officer to the Director General of the World Organization of Animal Health. Vaccines will be delivered in a timely manner and in flexible quantities, and this will allow countries to kick off their rabies elimination programs. The vaccine bank aims to convert demand for dog vaccines from a vicious cycle where demand is low, production is low, and vaccines are costly, to a virtuous one where demand is high, production is high, and vaccines can be provided at a lower cost. The revolving fund of the Pan-American Health Organization is a financial mechanism that gives access to affordable and high-quality human and dog vaccines and health supplies through a model of shared responsibility. It is open to PAHO member states and aims to promote efficient and sustainable health systems. In this module, you learned that the time to act is now, or human deaths, need for post-exposure prophylaxis, and inequities will grow. Rabies elimination contributes to a healthier, more equal, and more sustainable future. Mass dog vaccination is key to eliminating human rabies deaths. The 0x30 plan takes a One Health approach to drive access to post-exposure prophylaxis, awareness and community engagement, and mass dog vaccination. The United Against Rabies Forum works with countries and cross-sectoral stakeholders at the local, national, regional, and global levels to support rabies elimination. And complementary initiatives provide human and dog vaccines and financial resources. Here are the links to the documents and research papers on the topics covered by this module. This slide provides you with additional resources, including other open WHO courses that you may be interested in. In the next module of the course, we will focus on preventing rabies in people. I thank you for your attention.